does public involvement mean to you?
Public involvement it's the average Joe on the street, the Joe public, just getting involved with, in this case, the local authority, the health determinants, research collaboration, and just feeling involved. Yeah.
And how do you feel about having a voice? How has that been a thing? How has your voice been listened to and acted on?
It's been good, because a lot of the time the Joe public doesn't always get a chance to give their ideas or their thoughts across. And it's also good that, you know, members like yourself and Cecily are there to give a lot of help.
Yeah.
I think it's a good thing, to be fair, because I think a lot of organisations make all the rules, make all the decisions, but Joe on the street doesn't.
And these decisions are affecting our communities and our public, so having somebody from our communities and our public involved. Yeah, I totally agree. Honestly, that's our aims, to be fair. So what do you think would make it easier for our seldom heard groups, our communities, to be involved?
It's difficult because you could have language barriers, you could have learning disabilities or mental illness, you could have, you know, subgroups such as drinkers, drug takers, and homeless people, and, you know, people who, you know, I think it needs to be like a bespoke way of approaching each different.
Yeah, so there's no one size fits all.
No one size. For example, you might get a lot of elderly people, and we're being really broad here, responding, well, if you've got advertisements on bus shelters or on the bus, or you might have, you know, people with drugs or alcohol issues, if you're in touch with places like Turning Point or the NHS, you know. So
it's about going to where these groups are going to be.
Some groups will come to you, but other ones you will have to reach out.
Okay. So if there was one thing you could change about public involvement in our HDRC Leicestershire, what would that be?
The only thing at the minute, but I think this is me getting my head around it, is some of the big words.
Oh.
Does that make sense?
I am totally there with you as well. I still trip upon them big words. And I agree.
Yeah, I do remember when I came to the HDRC committee. What was it that I came to when I first met you?
So the Public Assembly.
The Public Assembly. Yeah. I remember one of the things that was raised there is that, you know, I think a lady who was disabled stood up and mentioned something. I said, an Asian lady. That the language isn't always accessible.
Yeah, I totally agree.
Yeah.
It has tripped us up a couple of times and still continues to do that. But no, that's great. So, well, thank you for talking with us today, and I look forward to working with you in the future.
Okay, thank you.